So this was applied practice for the Portuguese community in Brazil and the United States. So we did this as a part of, okay. This was during the COVID-19, 2021, and we didn't have our Dresden clinic was closed, and we didn't have any opportunity to do any intervention or any applied practice as Abrar did. And so we had to brainstorm, and then we decided with Dr. Wenes to have to design a program for the Portuguese community in Portuguese, and then we would do that in social media, wherever channel we could share on that time. And the issue was prevention of diabetes. This is a picture that Dr. Wenes sent to us. So sorry about that. It's a very terrible picture, but he is a vascular surgeon in south of Brazil. And he was mentioning that diabetes is kind of a tragedy for that population. And then he was doing 1 or 2 amputations per day in his practice there. And then there are more than 10,000 amputations per year, and 43% of those are caused by diabetes. In the United States, the number is much bigger than that. It's about, it's about 100,000 the total amputation, and looks like diabetes is going to be 80% of those, not 100,000. I have a hard time. I had a hard time to find those numbers. It looks like they don't want to say much about how much diabetes are being causing these amputations. But the big issue here is that most of these patients, let's see if I have in the next slide. Well, I don't have the next slide, but this is adults that are living with diabetes in Brazil in 2021, and 9% of the population. In the United States, we already passed 10%. And those, what I want to say, the major issue is that most of these guys that have diabetes, they are treating only with pills. And that's why they get into the amputation. They don't take care of their lifestyle. They think that just taking metformin will solve the problem, and they ended up with serious complications. Half of the Brazilian population do not exercise. BMI is increasing in the country. Hypertension is also, and a diet is becoming higher and higher in fat, meats, sugar, and refined grains. So this is another terrible picture. And then he sent all of these pictures. And I had to show you because this is what we tried to put in our slides to promote, that is a serious complication. Diabetes is the 5th world country in Brazil is the 50th world country with diabetes. The main one is China, second India, then United States, and then Pakistan as the 5th, as the 4th, and then Brazil. 16.8 million diabetics type 2 in the world, and 9% of the population over 18 years have this disease. And as you can imagine, it's a big toll, not only by health, but related to disability. If this disease causes this serious disease, the serious complication on amputation, and not talking about heart disease and blindness and kidney failure that is also related to the disease. So we designed, then I was with him helping to design, as is Portuguese is my native language, so it was easy for us to work together. And then we designed a series about 11 lectures that last about 15 minutes on diabetes prevention, definition, history, the influence of diet and exercise, fiber in the diet. Then we talk about epigenetics, and that part was done mostly by Dr. WENES REIS on the epigenetics, and herbals and prevention and reversion of the disease. By instance, in the epigenetics, it was interesting because we found some genes, precursor of genes that were activated to develop the GLUT4 vesicles in the cells once a person has a good habit of exercise, comparing with a person that didn't have those habits. And this was exciting to show. I should have got the slide, but the time didn't allow me for that. This was in Portuguese. I just have let's see if I can get the thing here on YouTube. Neurologists are stunned. They confirmed that handwriting is shrinking your... Wrong thing. I even don't know how to get out of this now, but... Go back to my presentation. I don't know what happened to my slides. When we want to do that, things don't work. Let's try one more time here. I think I click one more slide. Okay. So he's a physician in Brazil. He's a vascular surgeon. He finished in Brazil. In São Paulo University, he did his residence. And he was a student in preventive care. So we are talking about diabetes. That's a prevalent disease in the world, and diabetes is complicated. And this is the first time. This is... Yeah, it's just for you to know that we did that. So back to the lecture, and then we go to this one, and then so we use social media mostly. I mean, the lectures are still in YouTube, and we use Facebook from Brazilian friends in the United States, and then we went to the Brazilian churches and share with them the link, and then we share this to our contacts in Brazil and in Portugal. We have a few students in Portugal, and then the total from the 11 lectures we have 543 people. Well, this is what we did, and then as Dr. WENES is not here, he could share what was his impression about that. But again, this is what we did during the COVID-19 because there was no other way to do an applied practicum. But it was an important disease for us in Brazil, and you can imagine that this could be avoided, and that's the point. Even in the United States, I mean, those are diseases that we could avoid, and those tragedies we could avoid as much as we could, but it looks like it's not easy to promote that in some circles, because medicine is mostly what Abrar mentioned, is mostly focused on pills and on prescription, and then prescription is not enough to change the complications, the risk of complication of the disease. Questions? Open to questions.
Yeah, I had a question. You mentioned that Dr. Reis alluded to epigenetics, and I was wondering if there was any identification of any environmental factors that were working on upregulating or downregulating the genes. Were there any environmental factors that were specifically identified in relating to diabetes?
Oh boy, I don't remember that. I don't remember that. We saw a list of things there, and the one that I am very familiar with was the exercise, the lifestyle, but I don't remember if there is smoking also that affect the GLUT4 genes for GLUT4. That's what I remember, but I cannot tell you any other. I was expecting that he would be here. So sorry, doctor. I might take a look on that and give that answer later on.
I'm just curious if you, because I have a particular interest in air pollution, and we, Khaled Badri found association with air pollution in Parkinson's, which we're hoping he'd eventually publish. But I'm just wondering if there was any air pollution and the hazardous effects, the things we breathe, could relate to how people respond, to diabetes.
One thing I can tell you, when he was working and doing that surgeries and amputation, that he do 1 or 2 surgeries per day, is very far away from a big city. Is almost a rural place. I mean, the pollution there is very low. It's not in São Paulo. It's very south, in a city that has maybe not more than 30,000 people. So on that case is not related, but I believe in the literature there is something, but I don't remember what environmental factors are those.
I actually just had a follow-up question to what Dr. Beeson was asking about epigenetics. I was just wondering if you know, or if Dr. Reis was the one, how well that was received by the audience regarding epigenetics, risk for diabetes, because a lot of diabetes prevention programs focus on lifestyle, diet, exercise, maybe stress management, but they don't really go into things like you guys covered, epigenetics, and even herbal supplements. A lot of the DPP program doesn't go into. So I was just wondering how well that was received by the audience.
Yeah, that's one problem. That's one problem that we tried to be very comprehensive on that. And that's why we have epigenetics in one corner, we have diet and exercise and fiber, and then we have the supplements. By the way, the supplements was my lecture. It was not Dr. Reis. I added that. But a little, I use the book from Dr. Rip from the I teach one class on lifestyle management. By the way, we are teaching now, and for the students that are here, we use the lifestyle medicine book, and he mentioned those herbals there in his book that are have scientific effect on glucose. Most of that are decreasing absorption of glucose in the intestine, but there are some others that have a different mechanism, even in the receptor. So, but I don't have, and that's one of the failure here. we don't have much input from the audience on this kind of things. I mean, social media and YouTube and Facebook, we have people say, well, thank you, and it was good, and I appreciate that, but more than that, I think we don't have that information. Sorry about that, Dr. Polanyi.
That's okay.
Yeah. Any other question? Maybe I should stop recording now.